Hi, my name is Giles Stafford and I'm here to talk to you today about hip replacement under my care. The first thing to say is that although it's natural to be nervous about this, it really is a very good operation, probably the best operation we have in the whole of surgery, and a lot of things that you may be concerned about you really shouldn't. And this video is designed to try and help you understand what the pathway involves, what will happen and how to get through it. The first thing to say is, in my practice, every hip replacement is planned in a three-dimensional way. We use a combination of X-rays and CT scan for this, which is sent off to a company who will analyse your pelvic tilt and your spinal biomechanics and try and ascertain which position will be best for the implantation of the hip replacement, and also which sizes would also fit best. This process takes approximately 4 weeks, and so in my practice, if you are listed for a hip replacement, expect it to be done a minimum of 4 to 6 weeks following the consultation. During this time, we like you to do a fair amount of exercise or prehabilitation. Most of this is best if it's not impact exercise, so exercises such as swimming, the elliptical cross trainer, Pilates or cycling are to be recommended. The other thing to mention is that if you're a lady who takes hormone replacement therapy, that needs to be discussed, as a lot of hormone replacement therapies need to be stopped approximately 4 weeks prior to surgery, preferably 6. You will meet me at least twice prior to any operation. Obviously, first for a pre-op consultation and assessment, and go through, sometimes for further investigations. But prior to surgery, I'll normally see patients approximately 2 weeks prior to their operation date. At this stage, I'll go through things with you again and answer any last-minute questions, as we don't like you coming in on the day of surgery with concerns that haven't been addressed. With regards to the time of your admission, we'll contact you the day before your surgery and tell you what time we'd like you to come in. I like to stagger my admissions during the day so you're not sitting in the hospital for hours on end, and we'll confirm this with you as I say, on the day before surgery. On the day of surgery, we like to admit you approximately 2 hours prior to your surgery time. You'll be met at the front desk of the hospital by the admissions team, and they will take you up to the ward and take you to your room and show you around. We like you to have nothing solid to eat for approximately 6 hours prior to surgery, and again we will confirm the time that we'd like you to be what's described as nil by mouth the day before surgery. You can, however, drink clear fluids such as water, still water, no gas, up to around 2 hours prior to surgery, so you can maybe have a few sips of water just before you come in. Once on the ward, the nurses will get you ready, go through any last-minute paperwork and get you changed, ready for theatre. They'll put 2 compression stockings below your knee on either foot, and I will come up and see you in your room and just go through the consent form with you. There will be nothing new on the consent form which we have not discussed beforehand, and I'll have gone through the risk profile with you previously on at least one occasion. You will see the anaesthetist on the day of surgery prior to your operation. This will either be in your room or in the anaesthetic room. If you have any queries or concerns about the anaesthetic, you are welcome to ask me, as I have very much been involved in our anaesthetic pathways and can answer any questions you may have. Once you're down in the theatre complex, the anaesthetist will put you to sleep in one way or another, which we will have discussed beforehand. I'd like to reassure you that you will not be aware of the operation being done, and even if we use heavy sedation, you won't remember anything. We do not use urinary catheters, and so this is not something to be concerned about, and the operation itself takes approximately 1 hour. You'll be aware of being awake in the recovery room, and you'll be in there for approximately 30 minutes. When you wake up, depending on the anaesthetic we use, you may be able to feel your legs or not, depending on whether we've used a spinal anaesthetic combination. The one thing that we will always have is a small tube sticking out from the front of the operated thigh, which is attached to a bottle which has some local anaesthetic and other drugs, which we give you as an infusion over the next 36 hours to ensure that you don't have significant pain. Once you're back on the ward, the physiotherapist will come and visit you somewhere between 2 and 4 hours post-operatively, depending on how you're feeling. Most patients aren't particularly groggy, but it is quite common for people to feel a bit dizzy when they get up out of bed for the first time, and we give you some drugs to try and mitigate this. It's not usually very painful, and most people are pleasantly surprised by the lack of discomfort that they have during their operation or afterwards. The day after surgery, normally you'll be given breakfast and then showered. We like you to dress in your own clothes, and the physiotherapist will come and see you in the morning. I also like to get a check x-ray of the hip replacement on the morning, which I can see when I do a ward round at lunchtime. We like you to be dressed in your own clothes, and we like you sitting out of bed as soon as is possible, which is usually by around 9 or 10 o'clock the next morning. You will have physiotherapy 3 times a day, and this will involve going up and down stairs, going on an exercise bike, and obviously learning how to use crutches, which you'll probably need for up to around 4 weeks. After physiotherapy, we use ice compression packs. The make that we have in the hospital is made by a company called Physiolab, and you're welcome to hire these to take home directly from the company. They are usually extremely useful for post-physio or exercise pain relief, but obviously it's up to you as to whether you feel you want them. On the morning of the second post-operative day, which is usually the Thursday, again you'll be given breakfast and showered, and we like you to get you dressed as well. The anaesthetic catheter, which I've described earlier, will be removed usually at 9 o'clock on the Thursday morning. Usually the contents of the bottle has run out by then, and so expect the hip to feel a little bit stiff and sore on the Thursday. This is normal, and you'll find that as you get moving, it eases up very quickly. The physios will come and see you again, mobilise you up and down stairs, and ensure you're safe for discharge. Often, if the weather is nice, they'll take you for a walk outside as well, and you'll be using 1 or 2 crutches at this point normally. Some patients don't feel they need them, which is obviously fantastic, but I'd like to stress that this is not a race, and you must use whatever you're most comfortable with. Discharge time is usually 2 to 3 o'clock on Thursday afternoon. The nurses will remove the compression stockings. You do not need these at home, but I don't like the dressings changed routinely unless they need to be. You'll be given painkillers and some blood thinning tablets. We don't use the subcutaneous injections for blood thinning once you've gone home, and obviously you'll be using your crutches as needed. I'd like you to see a physiotherapist around 7 to 10 days post-operatively, and normally you'd see me around 2 weeks post-operatively, where I'll take the dressings off myself and have a look at the wound. The one thing to be aware of during the early post-operative stage is some patients find it very difficult or find it awkward to sleep through the night. They often wake up at around 3 o'clock, not with severe pain, but just unable to get back to sleep. The flip side of this is patients often feel quite tired in the afternoons and often have a nap after lunch. This is quite normal, and you should not be concerned about it, and usually goes away after about a fortnight. The crutches that you'll have, I'm happy for you to get rid of whenever you feel comfortable, and as I said earlier, this is not a race. Some patients feel able to get rid of them immediately and don't need to take them home, and some patients feel more comfortable with something for even up to 6 weeks. However, this has no bearing on your long-term recovery or what you should expect with regards to once the rehab is finished, what you should be able to do. After approximately 6 weeks, I will see you again in clinic, and at this point we take another x-ray to ensure everything is okay. By this stage, I'd expect you to be around 75% recovered, but not yet fully functional. Most people are back at work by this stage as well, but it does obviously depend on what you do. I will then see you again at the 12-week mark, which is 3 months post-op, which at this point we don't usually need an x-ray, but at this stage it's a check-in to ensure that you are where we would hope you to be with regards to your rehabilitation pathway, and at this point usually you can get back to more exertional activities such as running, tennis, a full round of golf and that sort of thing. If you have any queries about what you can do when, obviously speak to me or email us and I'll get back to you. By, however, 3 months, we normally expect patients to be around 90% better. It's often still painful to lie on the side, but it's on the operated side, but usually you're basically back to normal and someone looking at you in the street wouldn't know you'd had an operation. I also don't use the routine hip precautions that you may have learned or read about, which have been used for many years. This means that you don't necessarily need a raised toilet seat, although I'm happy for you to have one if you feel you need it. And you don't have to have chair raises or a bed downstairs or anything like that. I'm happy for you to sit on your normal sofa. I'm happy for you to cross your legs. And so the physios will go through these with you, but the one thing to say is I don't like people pushing the range of motion of their hip replacement too soon. With regards to sleeping, you don't have to sleep on your back for 6 weeks. I'm happy for you to sleep on your unoperated side with a pillow or two under your knee. The reason for this is that your hip is not going to dislocate at night, but the pillow is just there to try and take some of the tension out of the wound so you don't wake up in any muscle spasm. Most people find it very difficult to sleep on their back, and our experience and research has shown that it has no bearing on your recovery or dislocation rates. I will obviously talk you through this in person as well, and if you have any queries, don't hesitate to contact us.